Let's kick this off. Welcome to the Sleep Edit with Dr. Canaperi. I'm Craig Canaperi. I'm a pediatric sleep doctor and author, and I'm here to explore one of the most mysterious and sometimes troubling aspects of being a parent: how to make sure your child sleeps well so that you can sleep well, so everybody in the family can sleep well. My goal is to provide practical and evidence based information for parents, pediatricians, educators, sleep consultants, and anyone who's interested in this topic. On today's inaugural episode, I am so excited to have my friend Ariel Greenleaf to come and talk to us today. Before we get in the topic, Ariel, do you want to just introduce yourself and talk a little bit about your expertise in sleep?
Sure. I'm Ariel Greenleaf. I'm a formerly sleep deprived mom turned pediatric sleep consultant. I've been in the industry for the last 8 years and it has changed quite a bit since I started in 2016. Gosh, is it 2016? Yeah. And I trained more than 60 pediatric sleep consultants to help other families get the sleep that they need as well. I became a sleep consultant because a sleep consultant changed my life when my daughter was 5 months old and I had not slept a regular night in it. I say 5 months, but more like probably 2 months prior to having her too. So I probably hadn't slept in about 7 months, and hiring a sleep consultant and working with her for 2 weeks truly changed my life. And so from that point forward, I dedicated my life to helping others in that same situation.
That's great. That's one of the things I like about working in the sleep field because I wear two hats. I'm a sleep doctor and I'm also a pulmonologist. And I'm clearly important, right? Breathing is also very important. But I feel like in sleep, often just by providing good information to people, they can make impactful changes.
Mhm.
Like I could talk to you about your child's asthma, but they may still need some flow vent, right? But sometimes, not always, sleep issues can be addressed or at least improved with just good information and good support.
Absolutely.
So today, I we are going to talk about one of the most burning questions that parents have, which is specifically, how do I get my child to sleep through the night? The thing is, struggles at bedtime are annoying, but middle of the night awakenings and their close cousin, early morning awakenings, they're soul destroying. Really, that is what impacts parents so much. If you're arguing with your toddler for 2 hours a night, you can still go to bed and sleep for 7 or 8 hours. But if your child is waking up multiple times during the night, even if you get them back to sleep quickly, you're going to still be up awake, wondering when they're going to get up again. Ariel, would you say this is the most common thing that people would come to you with?
Absolutely. The majority of the families that come to me are waking multiple times a night. And I think the biggest thing we talk about, how I was personally, it was the disrupted sleep more than anything. Because even if, for instance, my daughter had only woken twice overnight, it was disturbing my sleep enough that then it took time for me to fall back asleep. And so I think absolutely a number one problem that people come to me with is multiple night wakings and or difficulty falling asleep at bedtime or early morning wake ups. I think all of those kind of go together.
I remember being a pediatric resident and where I would they don't residents don't do this anymore. Do work a 36-hour shift, and there's no guarantee of sleep whatsoever then. And I still felt more tired when my first son was a couple months of age than I did as a resident. Because the thing is, as a resident, there were I was on call every third or fourth night, so those other nights I was footloose and fancy free and could catch up. But as a parent, you don't usually have that luxury. It hopefully parents have a partner that actually participates in dealing with nighttime awakenings. Not everybody is that fortunate, whether or not they have a partner or another adult in the house can help or not. But the fact is, if your kid is crying and your partner is going to get them, you still wake up. It does take a toll. So I think we should start with a definition of how do we even define sleeping through the night, which is surprisingly less straightforward than it seems.
Yeah, absolutely. I think it would be helpful to hear the definition from a medical perspective because
Like,
sure,
you mean like me?
yeah, someone who went to med school and not just anecdotally. And there are plenty of definitions out there and on social media and in mom groups and things like that. And I think that many of the clients that come to me believe that sleeping through the night will mean that even their 2-month-old is going to sleep 12 hours through the night. So I think it's important to hear from your perspective what is realistic and what is sleeping through the night.
It's funny, I was rushing right before this to text a colleague who does research in sleep in young children. Because I was going back through books and articles, and I could not find actually a uniform definition, which I immediately attributed to my ignorance and stupidity. One and what she said to me is, "Look, practically, it means if your kid goes to sleep and then you don't hear from them till the morning, that's sleeping through the night. They may even wake up and be quiet." So that's one definition. But I think sometimes you make an important point, comes down to what is a reasonable expectation at different ages, because this changes so rapidly in the first year of a child's life. And just going back and forth with my colleague Monica Ordway, who I'm sure I'm going to have on the show. For an infant, if you could get 8 hours of sleep, I think that's pretty good. So for young infants, we might talk about putting them to bed on the early side, but then they get up and have, say, a dream feed at 10 o'clock at night. And then if they sleep to 6 in the morning, I think most of us, at least people working in the field, would be pretty happy with that as an outcome. I'd say that biologically, most infants have the physical capacity to sleep through the night by 6 months of age. It's more likely to happen younger for infants that have some formula feeding because it takes them longer to digest it. But obviously, there's a lot of benefits to breastfeeding as well. I'd say 6 to 9 months is a pretty reasonable expectation. What I want to say is, I don't want to get hung up on the definition, because the fact is, if you're tired and your child is waking up 3 or 4 times a night, what we're going to talk about today is how you reduce that number, right? It may not be perfect. And we're not going to go from 4 awakenings a night to no awakenings a night in one step, but we can start moving that needle to fewer and fewer disruptions, because it's hugely impactful to start peeling back some of those nighttime awakenings. So I'd say that for parents in general, if you've got a 1-month-old, they're going to be waking up at night. Once you get halfway through your child's first year, it's a reasonable expectation by 6 months that you're going to get a pretty good night of sleep there. And certainly by a year of age, absolutely. And sometimes people will come to see me, they've got like a 3-year-old that's taking 3 bottles of milk a night. I'm like, yeah, that you should want to fix that. The other thing I would say is, if you feel like you're doing well and your child is doing well and your child's waking up once or twice a night, you also don't have to make a change if you feel good and your child is doing well. That's the other side of it. But I imagine most people listening to this probably aren't that excited about how their child is sleeping. But I do want to validate is, if you're happy with how things are going, you feel good in the morning, everybody in the house feels good in the morning, your child's growing well, developing well, it doesn't have to be perfect.
I totally agree with that. Totally.
So the next thing I wanted to talk about is the timing and the nature of these nighttime awakenings, because I think often there are clues baked into this that help us figure out exactly what's going on. And Ariel, when we've talked about this in the past, I just wanted to start with those early evening awakenings,
Mhm.
because you've said something to me that is so interesting and useful that I wanted to revisit this. So what I'm talking about here is when parents say, I put my baby down at 7 o'clock or 8 o'clock, and they wake up within 30 or 45 minutes and they're crying and it's difficult to console. And I'm never quite sure what to do with that, but I have some real insight into this.
Yeah, in my experience, it depends on the age. I know I've shared that with you before, because I think a lot of times as newborns are becoming infants, so if we're looking at 3 months, 4 months, maybe even into 5 months, sometimes as we begin working with them, we're experiencing this, what some people call false starts. I don't personally look at it as a false start, because in my experience, what it generally means is the bed timing is off. So, in most instances, with the people that I'm working with, it means that bedtime is too late. And when we start to pull bedtime back a little bit, even if it's 15 or 20 minutes earlier, we can start to see some big changes in rectifying that early waking, the quick waking that almost seems like a nap. And I will say though, going back to that 3, 4, 5 month age group, sometimes they are still maturing, and sometimes it appears to be. I used to be like, oh no, they're not, they don't think it's a nap. That's not what this is. But I've seen it enough that I do think that sometimes their bodies just aren't ready for bedtime at whatever time it may be, 6:30, 7:30. But eventually it does start to pull back earlier. Give them, you can even check in with one of these people, one of these families 2 weeks later, and the baby is going to bed much earlier. But I would say with beyond 5 months, 6 months, usually the situation is that bedtime has gotten too late. The child's overtired going to bed. And then this also goes in with other things that we're going to talk about, which would be, what are they doing? What do you need to do to help your child fall asleep? Are they waking up because they fell asleep in your arms and they woke up and they're in their crib and you're no longer there in their crib and you're not there, you're not rocking them, you're not feeding them or whatever, so that they're not falling asleep independently. But I think in the two in conjunction, so if you're working on eliminating something like that, you want to be looking at the schedule, and you want to be looking at helping your child learn to fall asleep independently. And one other thing that I would say too is that ensuring that your child is getting fed regularly throughout the day and is taking full feedings throughout the day, which can be tricky because a lot of the families that I work with are, both parents are working. So the child is in the care of someone else. They're taking bottles. In some cases, if it's a breastfed baby, they may not want to take a bottle. They want to breastfeed. And so their bottles are much smaller. And then they may actually be waking out of hunger. But I would say the top reasons together would be the schedule combined with that dependency on someone or something to fall asleep and back to sleep.
So let's tease this out a little bit. Let's say I'm a parent. Like my 3-month-old, we've been making progress in the sleep. I'm putting him to bed at 8:30. He wakes up at 9 o'clock and he's inconsolable for 30 minutes. Tell me what to do to fix this.
So for my first go-to, and I think you and I have discussed this a little bit because I have originally, way back when, I studied a lot of, and he is the biggest, like, he is all about early bedtime. So I have always been a big fan of early bedtime. And I have seen, I would say more times than not, that backing up bedtime solves a lot of problems. And that is true for a lot of children, but it's not true for all children. However, in a situation like this one that you're explaining, I would want to know, how is the baby falling asleep? I want to see their feedings throughout the day. And then I really want to see, let's back up the schedule. What time is this baby waking for the day and then going to bed at 9 o'clock? A lot of times a parent will say she was up at 5:30 and took 6 30-minute naps throughout the day. And then I couldn't get her to go to bed until 9 o'clock. But a lot of times, because they're not getting a restorative nap or they're taking really short naps, they're just growing more and more overtired. And that makes them fight sleep even more and can lead to those false starts like we're talking about.
I struggle a little bit with the term overtired because I know what you mean, but I don't think there's a good definition for it. Sometimes, and I think in the future we can talk about bedtime battles, there is that sort of circadian second wind that people get where, and this is really common in parents, right? You lie down with your toddler, you fall asleep with them in their bed at 8 o'clock at night, and you're like, oh my God, I'm so tired, I could go to bed right now. And then you wake up and you're awake till 11 p.m. watching TV or reading a book or something. And some of what's going on there is that there are definitely circadian windows where it's easier to fall asleep. And there are windows where you have the surge of wakefulness. And it's pretty common in someone with a mature circadian system, which really is not an infant, right?
Sure.
The maturation of the circadian system happens over the first year of life. But having that sort of second wind is pretty common. I always joked with my kids is they have to be in bed by a certain time or they're going to be up for an hour and a half when they're
Yeah.
younger.
Mhm.
And the other thing is, if the bedtime slips a little bit later, bad stuff is going to happen when you're trying to get them to brush their teeth. I have two boys, they'd be slapping each other, running around with their pants off, just chaos. So we would really do everything we can to just get them into bed at that time. I think another thing to talk about is sleep, stages of sleep, right? There's a circadian cycle. That's the timing of your sleep and wake over a 24-hour period. Then there's what we call the ultradian cycle, and that is the cycle through different stages of sleep. So the way this manifests in adults is we will go to bed and we will have our biggest chunk of slow wave sleep, if we're lucky, about 2 hours shortly after we fall asleep. And then during the night, we will cycle through lighter stages of sleep, which is like stage 1, stage 2 in REM, and then deeper stages of sleep, stage 3 or slow wave sleep, with a cycle length of about 2 hours. So with children, those cycles are shorter and they happen more quickly. And the reason this is germane to nighttime awakenings is that long period of slow wave sleep. If you've ever it's the holidays, you're driving home, your kid falls asleep in the car seat, you transfer them to the crib, you feel like a parenting genius. They're in slow wave sleep. Nothing was going to wake them up. Also, sometimes for older children, if they're waking up during that time and they're absolutely inconsolable or they're wandering the house acting weird, that is a parasomnia, right? What we call a non-REM parasomnia. The most common are night terrors or sleep terrors, which can be 30 to 45 minutes of screaming and being inconsolable. Children are sweating, they're crying, nothing you do works, and they don't remember them the next day. It's hard to interrogate like a 9-month-old, but like an older child can't really tell you what happened. Sleepwalking is pretty easy to get, right? Because they're actually leaving the bed and walking around the house. My older son does this once in a while, and I'm a little bit concerned when he goes to college that as it does happen when he's stressed. And then there's confusional arousals, they're not quite a night terror, but someone may sit up, talk in a nonsensical way, go back to sleep. These are all non-REM parasomnias, most likely in that couple of hours after sleep onset. And then the sort of REM related phenomenon. So there's nightmares, right? Like nightmares have a narrative. If your child wakes up and says, the mouse was chasing me and he had a big hammer and I was just trying to get some cheese, that's a nightmare that came out of REM sleep because it had a clear story to it. But the other thing that is so common in kids are what we call sleep onset association disorder. Ariel, I don't know if you want to explain this a little bit here. This is such a common cause of nighttime awakenings.
Sure.
And it's really, when we're talking about sleep training, we're talking about addressing this problem commonly.
Sure. I think that's probably when I'm thinking about working with a client, again, it's let's look at the schedule and then let's figure out how is your child falling asleep. So what did you call it? Because you have like more of the medical term for it.
Sure. It used to be called, I'm not going to get into the international classification of sleep disorders, version 2, version 3, but the common term is sleep onset association disorder.
Okay, yeah.
Which was a subset of behavioral insomnia of childhood. All of these have been lumped under the rubric of chronic insomnia now, whether you're like age 3 or like 93. You had 3 months of sleep difficulties, you're meeting that definition. But I still think it's a useful term because it explains a little bit what's going on.
That's really interesting. That would even be classified as insomnia. But I suppose it's a dependency on something and it's disrupting, that dependency is disrupting either your ability to fall asleep or your ability to fall back asleep. So essentially what that means is what we're trying to do is teach babies and children to fall asleep independently. So without any sort of sleep onset dependency, really, rocking, walking, bouncing, driving in the car, feeding to sleep. We want to help the child or baby feel safe and comfortable in their own sleep space. So whether that be a bassinet or a play yard or their crib, helping them to learn that they don't need to. One of the biggest things, and I'm sure you've heard this, is my baby falls asleep so easily in my arms. I place her down in her crib and she just screams and she's up for hours. And we need to teach baby how to fall asleep comfortably in her own space. And that doesn't mean you have to place her in there, let her scream and walk away. it can be a slow progression out of the room. You slowly get her in there while she's drowsy, and then she might get a little upset, and you can put your hand on her, or maybe even pick her up and put her back down again. It could take a little bit of time, but eventually they do learn, okay, I am comfortable here, and I'm safe, and I can fall asleep without you. And I can also wake up in the middle of the night, as we all do, and turn around, realize where I am, and then fall back asleep without having to say, Mom, come save me. Dad, come save me. So that's really, in my opinion, that's really the definition of sleep training is let's get rid of the dependency on someone or something. It could be a pacifier. It doesn't even have to be a parent. It could be pacifier falls out, the baby freaks out. You have to go back in and plug it back, replug the baby. And so
Put it right in the cry hole.
yeah,
Plug it right up.
But there's so many people that play what we call passy pong all night long, and it's disrupting the parent's sleep and it's disrupting the child's sleep. So ultimately, the goal is to help the child fall asleep independently, feel safe and secure in their own sleep space, and that leads to, in general, leads to better sleep both during the day and overnight.
Yeah, I think that it is so important. And I just want to tease out a few parts of what you brought forward. The first is that what we're talking about are circumstances your child needs to fall asleep that are absent in the middle of the night. So if you rock your child to fall asleep, unless you are rocking them all night long, they are going to wake up and want to be rocked again. And the timing of this is with those bouts of REM sleep, because REM sleep is actually a pretty light stage of sleep. If you look at the EEG, like the brainwave pattern, it looks a lot like wakefulness. And if you've ever been woken up from a dream, you actually feel pretty awake. Like you're lucid. You can tell the story of what happened in that dream. Whereas if you wake up out of slow wave sleep, you feel very groggy. And there's a lot of what we call sleep inertia. So the timing of these events is usually parents get their child to fall asleep. There might be some struggles around it. They might be arguing with their toddler, eventually say they rock them to sleep, they lay down with them, they give them a bottle. Then the child has that nice bout of slow wave sleep for an hour and a half, 2 hours. Then when the parents are getting into bed, the children cry out for them, right? Like they call for them, and then the parents have to go and do it again. They have to rock them or feed them or what have you. And that can happen anytime there's an episode of REM sleep, which is, again, after that first part of the night, can happen every 1 to 2 hours. It doesn't have to happen every time, right? Like we've all seen those parents who are like, just they're dying because their kid's waking up every hour. But more common, it's a couple of times. And it may also manifest as an early morning awakening with that last REM period of the morning. Again, the second half of the night is weighted with more REM. And then the parents get in the habit of bringing the child into bed with them. And guess what? Your 2-year-old is not going to raise their hand and be like, Mom, I seem really tired since I'm getting up at 4:30 every morning. And then, as my younger son used to do, would stick his whole hand into my mouth if he was trying to sleep next to me. We called it mouth hands. They're not going to stop doing that on their own. So I think that really, and this is where it can be so helpful working with a sleep consultant, working with your pediatrician, you actually need to go through the story of what you're doing at bedtime. Usually these things are obvious, but occasionally they're not. It might be something like, back when people used to have CD players or something, right? They'd play their Dreamtime CD, their Baby Einstein or whatever, and that recording was 30 minutes long. The kid falls asleep when it's on. The parents have to go in and turn this on multiple times during the night. So anything that you don't want to have to do in the middle of the night, you should really try to avoid doing that at your child's bedtime. When they're infants, really aged 3 to 4 months of age, you try to put your child down drowsy but awake so they can start to learn to fall asleep independently. If it doesn't work, you can just then soothe them back to sleep and try again a couple of weeks later. They develop so quickly. And I would say that in general, just because we want to go through all the other causes, when we talk about sleep training, we are talking about removing the dependency of a child for their parents or caregivers at bedtime and in the middle of the night. And a lot of times, my mentor, Judy Owens, is like, people are tired in the middle of the night. So you just have to teach them to do whatever they're doing for sleep training. And it's not necessarily cry it out. It's a behavioral plan to get them to fall asleep independently. And then in the middle of the night, they can just do what they need to soothe their child, because if they establish independent sleep at bedtime, often, not always, but often, those middle of the night awakenings drop out over the course of 4 to 6 weeks. Because the fact is, we live in a country where parents don't have a lot of parental leave. There really aren't a lot of great supports. People don't have family members living in their house who can help them. A lot of parents have to go to work with it when they've got a 6 week old at home, and they just need to survive during the night. So I think in the future we can talk about different sleep training techniques,
Absolutely.
because there's a million of them, right? It's not just cry it out. And this always bothers me, right? My book's called It's Never Too Late to Sleep Train. And I didn't want the term sleep training in the title. Like, it has a certain valence to it. Like, I don't have a problem with it, but a lot of people do. And the fact is, well, my agent was like, nobody's going to know what you're talking about if you don't have sleep training. They were right about that, but that it has in some circles, it has a sort of a negative
Oh,
valence to the term.
absolutely. I feel like that's part of the mommy wars. It's
Oh,
this dividing conversation, and it doesn't need to be. I don't think I just don't think it needs to be.
and to come back to the definition of insomnia, a component of insomnia is not just what your sleep pattern is. It can be problems falling asleep, problems staying asleep. It's also impairment or unhappiness the next day. So for an adult, if an adult came in to, I don't see adults, but I see 22-year-olds. They came in, they're like, I sleep 6 hours a night. I have no problems getting out of bed. I'm not sleepy during the day. I'm straight A student in school. But someone told me there's a problem here. I'm like, there's not a problem. That's not insomnia. Insomnia has the definition of being unhappy with how things are going. And the way that manifests in young children is usually not, the kids are fine the next day, right? They can sleep in the car, they can sleep in the crib. They're not like driving minivans or giving presentations at work. They're just like, they can catch up, but it's the parents that are unhappy. And that's included in the definition of insomnia in childhood. If the parents are struggling as a result, that gets you to that insomnia definition.
Very
Uh,
interesting.
so let's talk about other causes of nighttime awakenings. And I know this is one of your favorite topics, Ariel. I think maybe we're going to just name this after you, and it's sleep regressions.
I was
So
like,
that's my reaction too, but I would love you to explain why, because we're on the same page.
so I'm a mom. So I'm in mom groups and I'm in parenting groups and I'm on social media. And anytime a child suddenly has some sort of a sleep disruption, is there an 11-month sleep regression? Is there a 10.5-month sleep regression? Is there a 13-month, 50? Every month apparently has a sleep regression. But the truth of the matter is that in many cases, when a child is developing, so progressing, not regressing, sleep might be disturbed. So, for instance, there is science that shows that learning to crawl, it affects particularly naps. And babies might be practicing their new skill in their crib. Gross motor developments, also learning cognitive development. So language development. Often, a lot of times people talk about their 21-month-old, their 22-month-old, what is going on? And I ask lots of questions. You have to ask lots of questions to get to the root cause of things. And they'll say, yeah, suddenly the child is speaking a full sentence. And it just started happening last week. And I'm like, when did the sleep disruption start? And they're like, 2 weeks ago. And so it's okay. A lot of times when they're regressing in the sleep department, they are progressing in other ways. And also, anytime a child gets sick and of course, you should be attending to them if they're waking in the night. Rules go out the window. If your child has a fever or they're throwing up or they're sick, they're not comfortable, you're going in there a lot and they may get used to that. And when they're better, they're like, wait, I liked it when he used to come in here and rub my back all night long. And then travel. We've got these progressions, we've got sickness. Travel is a huge one. Parents go away, they come back and they're like, I don't get it. My kid was sleeping so well. And now we're home and I'm trying to get back on track and the child is just not falling into place. Things are all over the place. Those are probably the top 3 things that I see with regard to sleep falling off the rails. But the problem becomes you might have a bad night or two. And then as a parent, you start second guessing yourself and you're like, maybe what I was doing is not working anymore. And my child is upset. They're not feeling well, or they're sad, or they're scared, or they're this, or they're that. And really, what it is, the child has grown accustomed to whatever new thing you've done to help them fall back asleep when they're having these arousals that they haven't had previously. So you might suddenly start going in and rocking again, or they're waking up at 4:30 in the morning all of a sudden, and you're like, oh, you're tired, so you're like, come to bed with me. And then you're like, why is he still waking? I thought this would be one thing. And in my experience, it starts to spiral. You do one thing and then all the other parts start to fall to the wayside, and nobody's sleeping. So sleep disturbance can happen at any age, depending on when a child is going through anything. And it can happen after sickness and travel. Those are the top things that I see the most.
Yeah, travel is one, and I'm definitely seen the kids where sleep was great, and then we took a trip,
Yeah.
shared a room or shared a bed with our 15-month-old, and then they come back and they just refuse to sleep in another situation. I want to say also too, it's funny because yeah, I agree with you. What bothers me about the term sleep regression is that yeah, if you Google the 3.17 year born in Mercury retrograde sleep regression, you're going to find it online, and this is just not how it works. Another thing is a lot of parents who had children that they really struggled with their child's sleep. They worked hard, they read a book, they went to see you, they went to see me, they fixed their kid's sleep. 6 months later, their kid gets a cold, or or stubs their toe at school, or nothing happens, and they're awake for 1 or 2 nights, and the parents are panicking. It's like PTSD. They're like, I didn't sleep for 3 years. Now we've had 6 good months, and I can't go back to the way that it was. And it's almost like you can't hold on too tightly, right? Like you can't white knuckle it too much, because it's just going to make things worse. And the other thing is sometimes with time we do get a little bit sloppy as parents, right? Like we're very regimented. Our kids, it's the holidays, our kids stay up a little bit later. We lie down with them because it's sweet and it's nice when they do that. And then you just need to tighten up your bedtime routine like a tiny bit, and you can get back to where you were.
Yeah, tightening it up
Um,
and then staying consistent with it. I'm just thinking
yeah.
about it. I just recently had a returning client, and I worked with her older son, and he did great. And then she had a second child. And it's funny, parents are like, oh, this is my third kid and I should know how to do this. And every kid is so different from the next. And first child could travel really easily. And now second child is a toddler, and they went and they traveled, and quite literally this child was like just not sleeping at all when they returned. And mom was just so desperate, and she knows what to do, right? She knows what's right. She knows what's worked. And you're just so tired at some point you start forgetting like who's in charge. Is it the kid that's in charge, or is it me? And like you start listening to this 22-month-old who's, no, we're going to walk around the house from 1 in the morning till 5 in the morning, and I want some snacks and I want a bottle. And then mom is like the next day, like, what am I doing wrong? And sometimes you just need to step back and have someone say, okay, I know it's scary, but what's scarier, getting up all night with your kid or staying consistent for a few nights? She might get upset, but if you don't do this, you're really going to be stuck in a bad place. But it happens a lot. I agree with you about the PTSD because I certainly had that. Anytime, because my daughter, sure, I got her sleeping well at 5 months, but I would say at least once a year until she was about 4, we would have maybe a 6 week period that I would just let things fall apart. And I'm going, what do I do? What do I do? And then I finally talked to a colleague, and they're like, what would you tell your client to do? And I'm like, fine. And then it takes 2 days. I get it done. And I'm like, why did I get myself to this place for 6 weeks of like newborn sleep? But it's hard to be a parent, period.
It is. And what do we call it? As I learned in medical school, the definition of a phase is when when a child is doing something annoying and we don't know why, but it's probably going to go away.
Yeah.
Kids, that's not the real medical definition. But I feel as a parent and as a doctor sometime, if I'm like, sometimes your child is gonna do something annoying for a finite period of time, and you're not gonna know why. I wrote on my website about how we have a guest bedroom, and my younger son, who at the time was like 11, or how old was he? He was like 10 or 11. He just started going to bed and sleeping through the night in the guest room, which is it was a little bit annoying to me because I was like, it's another bed to make or what have you, because he's not going to do it. But it really irked my older son because he felt like his younger brother was getting over on something. And I can tell you, as an older sibling, it is absolutely intolerable if you feel like your younger sibling is getting away with something. Still, it bugs me with my brother. I'm looking at you, Matthew. You know what you did. I think sometimes also we get annoyed by little things that kids do. And then you have to ask yourself, like, would an impartial observer find this annoying? And is this really causing a problem? Do they want to sleep with 10 stuffed animals? Let them sleep with 10 stuffed animals. Like, it's even if it's annoying to you, if it's not really causing a real problem, if you explain to your friends, be like, they're doing this is so annoying, they're like, what's the big deal? Maybe let some things go.
Yeah, definitely.
So I wanted to turn to something else you mentioned, which is our medical issues, which is is something that, again, we're not usually talking about serious medical issues, but sometimes parents come in and they think they've got a behavioral problem. What they really have is a medical problem. And the problem and a lot of common problems will manifest at night. Just to go through the list. Obviously, ear infections are very painful when you lie down, but there are also kids who have chronic otitis. They have just persistent fluid in their ears. Often, if that's treated with ear tubes, the sleep will get better. Acid reflux. If your child is spitting up a lot at night, treatment of the reflux may improve things. Eczema is actually a big one. And they showed even in older kids with eczema who are itching a lot at night, their sleep is disrupted to the point that they are impaired like a child with ADHD is impaired in terms of being able to regulate their own mood, behavior, and attention. Yeah, no, and it's worth knowing that this can actually anything that we all wake up during the night, right? Usually we roll over, go back to sleep, but anything that triggers more awakenings from your child may trigger them calling out to you. Asthma is one as well. A child with poorly controlled it's asthma will be coughing during the night and wheezing, and a lot of times kids come to see me for sleep problems, and I'm like, this kid does not has occult or they have hidden asthma. I treat the asthma, the sleep gets better. And the final thing I want to cover there is actually snoring. We all know what snoring is, right? Because if somebody else is doing it around you, it's really annoying. But the irony is that if you ask anyone, they will never tell you that they snore. But snoring is not normal. Like, snoring once in a while is fine, but children who snore loudly and regularly really deserve an evaluation with their pediatrician. They could have a condition called obstructive sleep apnea, which is where the airway, which is the tube that goes from the nose and the mouth down in the throat, gets closed periodically during the night. Oxygen levels can drop, etc. And I always tell the parents, the danger here is not that your child is going to just stop breathing in the middle of the night. The problem is that every time your child stops breathing, their brain has to turn on and wake them up a little bit so they breathe normally again. So it's not really dangerous in the short term, but it is dangerous in the long term to development and sleep quality. Lots of different treatments for it. Some kids need an overnight sleep test. A lot of kids just need to have their tonsils evaluated. But it's funny, during the pandemic, we saw no sleep apnea, right? Because one of the things that was driving kids' tonsils and adenoids, the most common cause of sleep apnea in young children are when their tonsils, which is the tissue in the back of their throat, or the adenoid, which is similar in the back of the nose, would get big, and they get big with recurrent respiratory infections, and then they tend to stay big. When kids weren't having any breathing illnesses, nobody was having sleep apnea, but now it's picked up again. And that's probably a whole other topic for a thing, but I'd say don't ignore snoring that's happening more than a couple times a week, and especially in infants. Infants snoring regularly is not normal. Worth talking with your pediatrician about.
I think it's so important for me to ask those questions right at the beginning before I even start working with somebody because it's so, I try to explain to them. Also, children who are struggling to gain weight, I would say that's another one that can cause sleep problems only because in those cases, many times a parent is has to wake the child up to eat because they only are taking 2 ounces every few hours or failure to thrive, those sort of things. That's something else that I always screen for. But I try to explain to the parent, I can't do anything behaviorally if the child isn't, yeah, like if the child's ears are hurting, you're not going to leave them to be alone. And we always need to make sure that health is addressed before doing any sort of behavioral work because it just won't, it's not going to work. That's why don't waste your money with me because it's definitely not going to work unless you have that everything's cleared.
I think there's a couple of really good points here. The first is your child has to be screened for a medical problem before you start with a significant behavioral plan. And globally, if they're not developing normally, if they're not growing normally, you're not looking at a behavioral problem. You're looking at a medical problem first. And I would say the other part of this is, to me, if a child is falling asleep on their own and waking up in the middle of the night, I'm taking a hard look at them for a medical problem. It isn't always a medical problem, but I'm ruling those things out because that's a really common manifestation of a medical disruptor of sleep is nighttime awakenings when the parents have everything dialed in with their bedtime. They're doing everything perfectly at bedtime. The child's falling asleep independently. The kid's waking up at night and they don't know why.
Craig, I have a question for you.
Sure.
What percentage of children have actual medical problems? And then what percentage of normally developing healthy children need some sort of a behavioral intervention?
The first one was what percentage of children presenting have actual medical problems? And it's a really good question, right? Because I could tell you like 1 to 3% of children will have sleep apnea, right? If they're obese and they snore, it's closer to 50%. All comers like presenting to the sleep lab, I'm not sure if anyone has those numbers. But what we see in sleep world is a lot of these problems are multifactorial, and it's just a fancy way of saying there's actually more than one cause. In medicine, we love Occam's razor. We're like, it's the most, which is just stating that the simplest single explanation is the cause of what's going on. But really, as one of my mentors used to say, the patient can have as many problems as they damn well please. So don't get hung up on that there has to be just one explanation. Though often, usually there is. Most children are pretty healthy. And sorry, what was the second part of your question?
I guess the second part of my question is there's having been in this industry for almost a decade and seeing such a rise in the industry and a need for sleep support, behavioral, non-medical. I'm wondering what percentage of the average developing child in the United States needs some sort of, or maybe it's the parents. Maybe the question is, do you think it would be beneficial for parents to have more of an understanding of how to handle sleep to avoid things spiraling out of control? Because I feel like there's a surge in the need for behavioral sleep specialists like myself.
I would agree. And there's a lot of different studies that have looked at this, but I've seen anywhere between 20 and 50% of parents being concerned enough to talk to their child's pediatrician at some point during their childhood about their child's sleep. Yeah. So you think about it, that's a huge number of people. And in some ways, there's more information available, but I feel like there's also a lot, the quality of information coming in is less. Right? Like it's harder for parents to know what's good information and what's not. That's why I started writing online. That's why you do some of your work too, is there's a lot of misinformation. Look, anybody's promising a quick fix or their own technique that they invented or their own terminology, which we see a lot online with things like wake windows, which I'm not even going to get into right now, which isn't based a lot in sort of science. Before we get sidetracked on one of my favorite hobby horses of all these weird stuff that goes on, I just want to make sure we cover a couple of other
Sure, let's do
potential
it.
causes of nighttime awakening.
Yep.
So, nighttime feeding and learned hunger. What's your take on this?
Oh gosh, I feel so. I always like to say, I am not, if a sleep consultant starts working with someone and says, without any digging, we're going to eliminate all feedings overnight really fast, we're just going to take them all away, run for your life. It is not my job to determine whether your child needs a feeding overnight. Now, that being said, if your child is normally developing, there are no health issues, and say this, you got a 7-month-old baby and they're waking every an hour and a half to eat, we got to look at that, because there's really no need for a 7-month-old to be waking up and eating every hour and a half. And I think that comes back to what we were talking about with learning how to fall asleep independently. In many cases, we see that those children are falling asleep on the bottle or on the boob, nursing to sleep. And when they wake up, that's the way they're falling back asleep. I do also think you talk about learned hunger. I always try to equate it. I think it's important for parents to understand we have all these terms, but what does that mean? So I see it as this. I got hungry for lunch at 11 a.m. today. Normally I eat at midnight or at noon. And today I was hungry at 11. And then tomorrow, oh, I'm hungry at 11 again. And then the next day. And so I eat and then I'm hungry at 11 again. It's very similar to a child that maybe doesn't even need a feeding, but they're waking up and their metabolism, they get fed and then their metabolism, oh, okay, that was nice. Maybe I am hungry at 11 a.m. every day or 11 p.m. every night. I think it's for what part of my job is, first of all, I want to know what the pediatrician has to say. If you're working with a lactation consultant, I want to know what they have to say. I think it's also important to look at how much are they getting throughout the day, because in many cases, feeding is another area where parents often don't know what's going on. Like they'll ask the pediatrician will give them a handout. Not all pediatricians, but some, well, this is how you're supposed to feed your baby. And a lot of times I have clients that are switching from breastfeeding to formula or vice versa. And not usually vice versa, but usually it's breastfeeding to formula. And it's important for parents to understand that's not a 1-to-1 ratio. So an average bottle size for a breastfed baby is 4 ounces, but that's really 3/4 or a half of what a formula fed baby bottle is going to look like. And they get confused. And then the baby really is hungry overnight. So looking at how many feeding sessions, how many ounces, things like that, let's ensure that this baby is getting fed throughout the day. And if they are, and they're normally developing in other ways, we can look at ways to at least get down to 1 feeding, something like that. I'd love to hear what you think about that in general.
Sure. Sure. I think a couple of things. First of all, it's trickier with moms that are breastfeeding, especially if they're breastfeeding exclusively, because the breast is such a powerful, it's so soothing, right? There's a lot of dimensions to breastfeeding because a lot of times, and I tend to see kids that are older, right? So someone's like nursing their child, they have no milk supply, they're nursing their toddler 5 times a night. It's not a nutritional problem at all.
Right.
What they are providing there is physical contact and comfort, and you don't need to worry about weaning those calories there. I'd say that certainly with a child that is growing well and moving along their growth curve, a lot of parents who are breastfeeding, especially the moms are back to working full time, they're happy to nurse once during the night. That's sustainable and it helps them maintain their milk supply. So I don't really rush people to get rid of that if they're happy with how things are going. In my world, a lot of times I am seeing older kids. They're nursing, they're drinking bottles, they're drinking juice during the night, and they are obese. So I'd say as a rule of thumb, honestly, a normally growing child over a year of age does not really need those calories at night. And if you find that you are needing to give milk or anything else during the night, I give you permission to cut it out. And you may want to wean it slowly. That's what Ferber talks about in his book, and I've had good luck with that. Other parents have wanted to just, they don't want to be like measuring out different aliquots of milk during the night, and they just want to go cold turkey again. It may be a little bit more conflict, but it could be the right fit. But again, this is why you have to work with your pediatrician, because I think it's very hard to sort this in the first 6 months of life. In the 6 to 12 months, it's a little bit easier, but it's not a slam dunk that you can necessarily just get rid of this. After a year, honestly, if you don't want to do it anymore, you don't have to do it anymore. Would you say that's fair?
Yeah, and I think yes, and I think that it's another area where education is needed for parents, because the switch from nursing all day or giving formula all day to solids is a strange one. Nobody really guides you through that. And a lot of what I find is parents are concerned that their child is not getting enough milk. And they think that it's still this mandatory thing that they get 24 ounces of milk every day. So they're like, the only time he will take a bottle is at bedtime and the middle of the night and as soon as he wakes up. So they're like very concerned about that piece. So I feel like that's where more education might be needed so that parents can understand a healthy, normally developing toddler does not need that. Does not need that. And I also think it's important to note that toddlers grow, that their growth is so much slower than an infant from birth to age 12 months. It slows down exponentially compared to an infant, a child who's born at 5 pounds, and by 12 months, they're 20 pounds or 25 pounds. That's a huge growth, and they need lots of breast milk and formula. But as they get into toddlers, they become pickier, and they're not gaining 20 pounds the second year of life. And so
hopefully not.
No, yeah, hopefully not. And so actually, Dr. Porto was one of those people that I've talked about this with.
And just Anthony Porto, who I work with at Yale, who's a pediatric GI doctor who's written a wonderful book on feeding in children.
Yes, he's
I highly
incredible.
recommend. I don't remember the title of it, but I'll put it in the show notes.
Yeah, oh man.
Guide to Feeding or something.
The Pediatrician's Guide to Feeding Babies and Toddlers. Yeah, we can put that in the notes. But point being is, I've had my own pediatrician say this. I've talked to Dr. Porto about this, and toddlers, it's like parents will be like, they only ate a handful of this and a handful of that. And basically that's normal for toddlers. It's normal for them. Like basically if they have one good meal in 36 hours, you're doing just fine. So understanding that is important.
Everybody thinks they're a feeding genius with their 10-month-old. Be like, oh, look, he eats avocados. Oh, and then a year later, and you're just like, screw it, let's just give him chicken nuggets again.
Yeah. Yeah.
The toddler diet, it's all tan, right?
Yeah,
French fries, chicken nuggets. I don't know, that's it basically. Yeah, it is what it is. Yeah. Don't judge anyone until you've been there yourself.
Right.
Oh man, could do a whole show about things I never thought I would do as a parent.
Oh yeah.
Yes, just feeding my child salami from the bag.
Yeah,
for
sure.
Dinner. Yeah, sure.
Here, take the bag. Take the bag for yourself. Walk away with it.
Throw it on the floor.
That's fine.
But just distract it for a little bit. So I wanted to talk a little bit about adjustment issues. I don't know if this is a terminology that is used a lot in your practice.
Adjustment issues with regard to changes in life, or changes in, for instance, transitioning from the crib to the toddler bed, or adding a sibling.
So I'd say that adjustment insomnia, there is a technical definition. It's less than 30 days of disruption of sleep when there's a major life change. So you mentioned a big one, new baby in a home, moving to a new home is one. Certainly it can be things like if parents separate is one, and that it tends to be a little bit more complicated to unravel or deal with, obviously, because it's an ongoing stressor for children. A lot of the times for most of these things that are not as significant a life change, again, having a new sibling is a big deal, but children tend to habituate it pretty quickly. I think the key is with a lot of these is making sure that your child is getting more attention during the day to support them through these changes, because otherwise they are going to be looking for that attention during the night.
Yes.
And it is okay to give that to them during the night. One thing I will say that parents, I think, worry about too much is a new baby or another child disrupting their children's sleep. In my experience, if a 2-year-old is sleeping well when the baby is born, when the baby is crying, they're probably going to sleep through it a lot of the time. It's less of an issue that parents think it is, because parents worry about things like sharing rooms. If your kids have to, I wrote an article in the New York Times. Like, if your kids have to share a room or you want them to share a room, it's fine. That's really until very recently, it was unusual for children to have their own rooms. It's a luxury, right, for that to happen.
Yeah, I
So I'd say,
think
no, I was going to say, if you've got these big changes on the horizon, don't be surprised if there's a little bit of disruption, but it shouldn't really last that long.
yes. And I wholeheartedly agree with more attention during the day. You mentioned the sibling thing, and I find you're absolutely right with they're always worried that the crying is going to wake up the older sibling. But I find that the bigger issue that I see is a little bit of jealousy because the older child wants to be sleeping in the room as the same room as the baby. Why does baby get to sleep in the room but I don't? And so having I with the sibling thing, I always try to encourage make sure the child is getting a little bit of extra attention from one or both of the parents during the day where it's one-on-one. It's not there's if you can, obviously this isn't always doable, but one-on-one attention, even if it's 15 minutes at the playground or something just quick, but it's meaningful. That's important. But I also find that playing up the role of big sibling and making it an exciting thing and giving the child a job to help you. Oh, you're helping Kitchen Cook, grab me those diapers. That's so helpful. You're helping. What a great big sibling you are. Like involving them in the daily mundane things that seem like nothing, that can make a huge difference. And I agree with you that if you start to the child just wants to feel included and as though they're still important. So making sure you've got that and reestablishing that if needed, that should help with overnight.
Yeah. I think the best single piece of advice I got when I had young children was give your child a job,
Yeah.
like in any situation. Like, when they are bored, they will give themselves a job, and it is often a job that you wish they did not have.
Yeah, sure.
I don't know. I perhaps I'm hallucinating, but I feel like my younger brother stuck pieces of cheese in the VCR back when VCRs were things that people had. I was
Oh,
trying to think of an analogous. I'm like, CD player? I'm really dating
DVD
myself here.
player,
Yeah,
DVD.
TV.
Yeah,
So, kids these days, even the parents these days are less familiar with some of these
that's
ancient
right.
technologies.
Yeah.
So, let's talk about nighttime fears. That's another one that can some often is more emergent at bedtime, but can also emerge during the night. Well, how often when do we are you seeing nighttime fears or dealing with them?
I don't really see a lot of nighttime fears. I do. I think that sometimes children want to name a reason why they feel they need the assistance of their parents. So they may say, I'm scared of something so silly like lobsters. I'm scared of lobsters. It's okay. We know that there are going to be lobsters in your bedroom, but it's like, why are you calling me in here? What is the reason? And I think that a lot of times they can't name what the fear is. And if you look at child development around that toddler age, that 3-year-old, 4-year-old thing, their biggest fear is really being separated from their parents. So reassuring them that you're going to be there. I love using things like a bedtime book that you make with the child that has real photos of you sleeping in your bed, the child sleeping in their bed, nothing going on overnight, everyone waking up happy from their own bed and doing that repetitively. I think it's almost there's a lot of FOMO going on at this age. And but with regard to fears, I know you're not a huge fan of Monster Spray. I like to use it as like sleep spray or happy sleep spray.
Why don't you
Um,
just explain what that is? Because
so
that's like,
yeah, so like so a Monster Spray is no, you basically fill up a jug of spray bottle with water and you say spray this to keep the monsters away. We don't want to really feed into their whole belief that there's a monster in the room. Although I will find this, I do find some children want it to be that way versus this is just for happy sleep. They like having control over their fear. So I'm spraying this and I'm keeping away the lobsters. Okay, great. But for other children, it's just
I
going
mean,
up.
here's the thing about that spray, it totally works. You start spraying that stuff around, 100% guarantee, no
No
lobsters.
lobsters, no lobsters in the room.
Yeah, it totally
So
does work.
it works. And then, but
I'm just imagining the bedtime book, and then they're flipping through, and all of it there's a picture of the child
there's
sleeping, and then
gloves.
a picture of the child with a lobster, like a lobster on top of them,
Oh
and I'm like,
gosh.
"Don't do this at home,
Sound
kids." I mean,
asleep.
it would be funny, but don't traumatize your kids.
No.
Doctor.
Yeah. And then the flip side is instead of like playing up the idea that these fears are real, just using the sleep spray to spray the room and say, this is happy fairy sleep spray or something like that. That can be helpful for some children. These tactics don't work for everybody, but those are certainly some of the things that I utilize with my toddler and preschool clients.
A lot of the time when you can present a couple of these options to parents and they have a feel for what's gonna work with their kid.
Absolutely.
Like one thing I like for this is a Huggy Puppy, which is it's an intervention where you give a child a stuffed animal. There's a story that goes with it about how this is a lonely puppy and he's a little bit scared. So can you take him and have him stay with you and comfort him at night? And they found that children, even children who've experienced real trauma, this is, and I'll put a pin in that for a second, was very helpful with them sleeping through the night and then helping somebody else made them feel braver. But there are some kid, this works great for a kid that likes stuffed animals. I've had some parents be like, yeah, my kid doesn't want to sleep with a stuffed animal. She doesn't like stuffed animals. This is not going to work for them. And I would say, as just to come back to the trauma aspect, we know that people have experienced trauma in their lives. And unfortunately, it's common in the US, it's common in other parts of the world. It can manifest as significant sleep difficulties. And sometimes it's a very clear trauma, like a child being in a car accident. I'm not going to repeat some of the stories I've had, the children have told me that are surprising and really terrible things, them witnessing terrible things. And sometimes it's something like a near miss car accident where nothing bad happened, but they can't stop thinking about it. And I say in a situation like that, if a child is referencing something in their experience that happened to them, or even something they heard about happening to another family member, usually to unpack that, you really need some professional help for that. That's not something you tackle on your own. So in that scenario, again, I don't want parents to be like, "Oh, my kid's waking up at night." I'm worried that there's something hidden as horrible as happened to them. You'd almost always know what this event was, and older kids are going to be telling you about it. This is really an opportunity to work with your pediatrician and a mental health provider to unpack that sort of stuff. That is not, I'm not a psychiatrist. I have a psychologist that I work with. It's not really, even a primary care doctor or sleep consultant, this is not their wheelhouse to deal with those sort of things.
Agreed.
So I think we have two more on our list. One is environmental causes. These are slam dunks if you can find them, like
And
environmental causes of nighttime awakening.
well, environmental causes, it's interesting that you bring that up because I remember working one time with this family and it was twin 9-year-old girls and a 5-year-old girl, and they all ended up in bed with their parents, all of them, every night since the 9-year-olds were born. They all ended up in their parents' bed by the end of the night. And I actually went into their house. I don't do that frequently, but I did. And we sat in the bedroom where the two older siblings shared, they were twins, they shared a room. And I said, What in here bothers you? What, if we're shutting the lights off, we're getting ready for bed, is there anything in here that bothers you? And she said, Yeah, that doll is always staring at me. And the mom said, You never ever told me that. And she said, Yeah, it freaks me out. And I said, Okay, we can remove the doll. And she said, And I don't like it when the light is on in the closet and the door is slightly ajar. And she's like, Why haven't you ever said that or changed it? And she's, I don't know. I guess I never really thought about it. Now she's a lot older, so she's 9 and she could tell us that. I think there are things that bother us and then bother children, and we need to be looking at that. And I also think so for light is an interesting thing because a lot of times we're like, don't bother with a nightlight when they're little, like babies. You don't need to worry about it. They're not afraid of dark at that age. But I think that some children do get afraid of the dark as they get older, and adding the nightlight can be a game changer. Others, they don't like the light at all. They don't want to see shadows. So that's certainly something you can control. But what other things do you think about?
Yeah, I just have a question about this doll. Was it like
Oh,
that creepy clown doll in Poltergeist? Because honestly,
that
yeah, that
wasn't
you
that
get that thing out of the
scary.
room.
It was like an older, I think it was like the mom's doll. It was definitely an older doll that looked a little creepy.
Was it Annabelle from the
No,
or the Conjuring
close, close.
movies or something like that?
No, and my daughter
Yeah,
has this stuffed
it
unicorn
was
that has the
Jigsaw from the Saw movies.
yeah, my daughter has this unicorn that has big eyes, and she's this unicorn just staring at me all night. I'm like, let's get rid of it. If it's
Totally.
bothering you, why are
Just,
you keeping it in here?
yeah, no, I think, look, technology is a big one, right? Don't have televisions, smartphones, tablets in your kid's room. No, look, no matter what, right? Most of the people listening to this probably have younger kids, but don't start. If there's a sibling in the room, does the sibling snore? I've had kids coming to see me and they're like, "Oh yeah, my sibling is up snoring all night." You're like, "Really? It's the sibling that needs to come to see me for their sleep apnea." The neighbors, right? Like I live in the suburbs, but a lot of people live in cities and they live in apartments with thin walls. So the neighbors get up at a certain time. The trash collection comes at a certain time. Things like sound masking, like with a sound machine, can be helpful. Again,
Nice.
don't put it near your kid's ear, but like running a fan can help mask some of those signs. Blackout curtains are great.
Mhm.
And one thing I want to say too is I see some kids who have problems, they have sensory disorders. They're common in children with autism, but also in children without autism, where say certain tags on their clothes will bother them. They're very finicky. They have to have certain socks without seams, etc. And sometimes those children will actually respond well to if they like to be wrapped up tightly. I like a lycra sheet, which is like a sheet that will wrap around the child's mattress like a sock and they will slide into it. I say this is clearly not for an infant
Right.
or even a young toddler, but for an older kid, that can be very helpful. And really, for me, those kids, I'm showing them a picture in the clinic. Does this look comfortable to you? And they're like, "Oh yeah, I'd like to try that." It's $20. Whereas a good weighted blanket, honestly, what I like weighted, you get the same benefit as a weighted blanket, but weighted blankets are hot, so they don't work well in the summertime, and they're
They're
expensive,
very
and
expensive.
they fall
Yeah.
like they fall right off. Also, if your kid really is having a lot of sensory issues, struggles, loud noises bothering them, etc., working with an occupational therapist can actually be game changing. So I think that's an important thing to think about. And then our last cause we're going to talk about is something called too much time in bed syndrome. So this term comes from a sleep psychologist named Brett Kuhn, who works out in Nebraska. He's written done a lot of good work in the behavioral sleep space. And this is where parents are having their child in bed for a period of time that is too long for their sleep needs. So you mentioned like Mark Weisbluth, like he likes early bedtimes, which really do work well for some kids. But we know that as you get older, your sleep needs reduce. So if you had a 1 year old that was sleeping great from 6 p.m. to 6 a.m., so they're sleeping 12 hours a night, everybody's high-fiving and singing kumbaya, like mission accomplished, right? And then all of a sudden at age 3 or 4, the parents have kept the same schedule. And this kid will start waking up in the middle of the night for an hour or two, quietly playing in their room. Not that quiet because the parents are waking up and calling me about it. But and the key with this condition is the sleep opportunity is on the long side for their age, and their bedtime is good. They're falling asleep independently, and they're not necessarily going to get the parents at night. They're just playing in the room quietly because the problem is not that they can't fall asleep on their own. The problem is they just have insufficient sleep. So another way this can manifest is when children are getting to the age when they're ready to drop a nap. So like you have a 3 year old and all of a sudden when they take a nap at daycare, they're falling asleep at 10 o'clock at night after 3 hours of arguing with their parents. And on the weekends, they refuse to nap and they're falling asleep at 7 or 8 o'clock at night. And that is often a signal that it is time for that child to drop the nap. And again, naps are a whole other domain of agony to talk about
Cool.
because if you think nighttime's tough, nap time is like the Wild West for lots of different reasons. But I know what's your take on this and the kids that like there's a disconnect between how much time they're spending in bed and how much time they really need, how
I
much sleep they really need.
Sure. I think it's interesting because you mentioned earlier that you don't tend to work with infants. And a lot of the people that I see are on the younger side. I definitely see the older side, and I 100% agree with you about the dropping of the nap. It gets so frustrating because we're so limited with childcare, daycare centers. You know that this child needs to drop this nap. It's affecting their nighttime. It's affecting the parents' nighttime. The whole family is suffering, but the daycare center can't accommodate dropping the nap because they don't have anybody to actually watch the kids that don't nap. It's a very tricky situation and frustrating. And as a working parent, I understand that frustration, but it's frustrating when I get a client like that can't control what's happening during the day because you're absolutely right. They max out on their sleep. They no longer need a 2 hour nap and a 12-hour night. They might need a 10-hour day total. And that's okay. And they're doing just fine with it. But sometimes you can't control that in today's society. But I see that a lot and absolutely agree with you. That's a sign that it's time to drop the nap. We either see it, I usually see it either at bedtime, the kid naps, bedtime's a disaster, or on the other end, kid naps, falls asleep just fine, but is up at 4 in the morning suddenly and can't go back to sleep. With infants, I find that the opposite is often true. Parents don't know a lot of times how much sleep infants need and just how important an age appropriate schedule is. And so I'll get parents that they want to take their children out until 11 p.m. and they don't understand why this isn't working for their child. And you explain that infants need 12 to 16 hours of sleep in a 24-hour period. But that again goes back to what you're talking about because for a 12-hour total sleeper, you're looking at that includes naps. So the baby might be sleeping 2 hours total in naps during the day. They're only going to sleep only 10 hours overnight. Whereas the baby that needs 16 hours of sleep is getting 4 hours of sleep during the day and 12 hours overnight. And going back to wake windows, those wake windows are wildly different. You're looking at 12 hours of awake time versus 8 hours of awake time during the day. And that's a big variance. So I definitely agree with the too much time in bed and having the over expectation that your child should be sleeping way more. But I also see on the other end that parents just don't know how much sleep their child should be getting and what does a restorative nap look like? How long should that be in order to keep them well rested throughout the day and get them to a bedtime? But the parents also often want a bedtime that is too late for their child, and that then
Yeah,
cause
so because
problems.
so both parents can see them when they get home and stuff like that.
Yeah.
Yeah, no, this is valuable to me because the nature of my practice is we have a long wait list. We see a lot of medically complex children. So when people
Sure.
come to see me, they've been struggling for a while, and I'd say my clinic population is enriched for kids who have some layer of medical complexity here. But it is so that first year is so hard, and it's really hard to make blanket recommendations. We're going to put in the show notes the link to the normal sleep ranges for age, but with babies, it's a huge range of normal. What we do know is kids who are high sleep need in infancy, they're going to be higher sleep needs throughout childhood. And a lot of times, honestly, you're talking about the population of people who kids have high sleep needs and the parents are struggling. In my experience, a lot of the times, especially if it's a first kid, those parents feel like they're geniuses, right? They figured it out. All their friends are hysterical and they're like, I don't know, my kid sleeps great no matter what I do. But then if they have a second kid and that kid cannot just nap ad lib and they have to take that kid out of the crib to pick up the other kid at preschool, then things fall apart. My older kid was one of those long sleepers, and we brought him home from the hospital after 4 days. And back then, there was not really a recommendation that they stay in the room with you.
Mhm.
That's like relatively new. He's 16 now because for SIDS prevention. And he slept for 8 or 9 hours a night, our first night home. And I woke up and I'm like, oh my God, he's dead. Like I could joke about it now because he was fine, but I sprinted into his room. Um, so I think to just bring this all together. If we want to try to generalize this for what are parents, what are the take homes for parents? I would say that the first thing is make sure there's not a medical problem, right? If your child is not sleeping through the night, meet with the pediatrician, make sure they're growing normally, developing normally, and that any the common garden variety problems they have, like eczema, are well addressed, right? I think that's step one, right?
Absolutely. Get medical clearance, step one.
I
Absolutely.
think I think step two is actually getting some data, right? Track your kids' sleep for 3 days. Again, it's not, you just write it down when they're falling asleep, when they're waking up, note when the awakenings are, and look at where their sleep duration is. Are they falling in the middle of those sleep needs by age? If not, if they're like way less than it, they probably need more sleep. If they're on the high end or higher, they might actually benefit from a later bedtime or dropping a nap. Again, it's hard to generalize, right? Because we're talking about kids from 3 or 4 months of age till, I don't know, age 10 here.
Yeah.
But really knowing where your child is your child falling in the normal sleep range or not? That is a really important clue. And I think really working towards independent sleep at bedtime. That's the third step. That is sleep training. Whether
Yes.
your kid is 6 months age or 6 years of age, there's a million different ways to do it, and we can talk about it. But I guarantee you, there is a technique as a parent that you will feel comfortable doing. If I don't recommend cry it out with a 4-year-old, right? But it might work well if you've got a 7-month-old. But it has to feel in accord with your parenting values. I don't know. What am I missing? What are any other big top line take homes for people?
No, I don't think you're missing anything. I think the independent sleep, first of all, yeah, the medical clearance tracking is really important. And if you're confused about your tracking, talk to your doctor. Ask if it looks normal and if it doesn't. And then absolutely the next step is figuring out how can I help my baby or child fall asleep without needing me to do something extra. And again, we could talk about that. You can talk about that at another time, but it does not need to be you just plop them in the crib and walk out and let them scream. You can be there with the child to help them learn to feel safe and secure there. And then, like you had said, once the child is able to fall asleep that way, that's going to overlap throughout the night and then during the day. They are going to catch on and realize that they're safe, secure, happy, healthy, all of that, and fall back asleep without much assistance or any assistance.
When you think about it as a parent, your children are going to learn to do stuff on their own, right? But you can help them. You help them by introducing solids at the right time. You help them when they're learning to walk, you're like holding their hand. And this is another situation. You are teaching your children an incredibly valuable life skill to be good sleepers, right? I'm always like, some good sleepers are born and others are made. So if you're struggling, let's make your child a good sleeper. So Ariel, anything you want to plug? Where can people find you online?
I'm not actively practicing at the moment, but if you want to reach out with me with any questions, concerns, thoughts, or ideas, I can be reached at ariel@arielgreenleaf.com.
Okay, we look forward to a bunch of emails now.
Whatever. That's fine. Bye.